Good morning, everyone, and welcome. My name is Gary Parker. I'm the Associate Dean for External Affairs at the Brown School at Washington University in St. Louis, where I also have the privilege of serving as the director of the Clark Fox Policy Institute. And welcome to our series, COVID-19 and Race. Today, we're at part 4, which will be looking at Native communities and COVID, reflections of the past and outlooks for the future. Before we begin, I just want to share with you the 3 previous parts can be found on the Clark Fox Policy Institute website, and I'll be putting a link to those in the chat feature. Also want to share with you that we have a few more parts coming your way. Part 5, COVID-19 and Race, will be health and economic disparities in the Latinx community, and that's scheduled for Thursday, June 30th at 3 o'clock. And then for part 6, talking to children about race and social justice. I'm particularly looking forward to this one. We have some really amazing speakers, including Adelaide Lancaster from We Stories, and that is scheduled for Thursday, July 9th at 12:30. And in the works, we don't have it scheduled just yet, but Atia and Cynthia Williams, our Assistant Dean for Community Partnerships, are pulling it together. It'll be how teens talk to each other about race. That will definitely be an enlightening conversation. Registration for all of those are available at the Brown School's Open Classroom page, and I want to thank Janet Gillow and the team in ProfDev for all their help in producing today's event. So although we can't hear you or see you, we want you to be a part of today's conversation, so please share your thoughts and questions with our moderators, and they will share them with our panelists. And our moderators today are Atia Thurman, Associate Director for the Clark Fox Policy Institute, and Kelly Thompson, Director of the Booter Center. I want to share a special thank you to Kelly for not only moderating, but producing today's event. We would not be able to have this conversation without her. Thank you so much, Kelly. And with that, please welcome Atia and Kelly.
Hi. Good morning, welcome. We're so grateful that you all have joined us for this conversation. This is our 4th episode, as Gary said, of the COVID-19 and Race series, Native Communities and COVID-19. The coronavirus pandemic has exposed glaring health and economic disparities amongst communities of color across the entire United States. And the data keeps rolling in, and the data keeps telling the same story of the societal systems that are failing communities of color, and the disparate and devastating impacts on Black and Brown people, which point to a more insidious disease and the underlying condition that has long been diagnosed of structural racism. COVID-19 is disproportionately affecting Native communities, and while these communities are not new to devastation from disease, trauma, and broken treaties, this latest public health crisis reveals deep roots of systemic injustices that have spanned thousands of years, hundreds of years, hundreds. Feels like thousands, I'm telling you. I am Atia Thurman. I'm Associate Director of the Clark Fox Policy Institute, which was founded by the Brown School at Washington University in St. Louis. The Policy Institute works to address systemic inequities so that all children and the adults, the people who care for them, have the opportunity to thrive. I would like to give a special thank you and acknowledgement to the Institute's Director, Gary Parker, for his leadership and as the Executive Director of this series, to Janet Gillow in the Open Classrooms. And today we have the distinct honor of hosting the panel in partnership with the Kathryn M Center for American Indian Studies. And so I'd like to turn it over to my co-moderator and the center's director, Kelly Thompson.
Wonderful, thank you so much, Atia, and thank you to Gary and Janet as well for helping us launch this panel and put this together. Welcome everyone to the COVID and Race panel that we will focus on Native communities. And I'm so pleased to co-moderate today. And I am, like Atia and Gary said, I'm Kelly Thompson. I am from the Seneca Nation from Western New York, and I am the director of the Kathryn M Center for American Indian Studies. And I'd like to begin by providing some general contextual information for our audience today. And many of us may know this, and historical and structural racism and oppression has created our current conditions. And our current conditions put Native people and Native communities at higher risk for such devastation as COVID-19. Our population lives on and off our reservation lands, and I hope that our panelists will speak to both of these communities. The National Congress of American Indians releases a weekly data report that shows COVID-19 trends in Indian country. And although they acknowledge, although that this data is rare and unique and one of the only national data sets that we can see, they acknowledge that it likely does not represent the true picture of our losses. And they say that this is due to the current lack of adequate testing availability and inaccurate reporting of race and ethnicity. Up to 20 to 30% of cases are inaccurately reported. And unfortunately, these gaps and disparities continue to grow when we look at Native and non-Native individuals, as well as among tribal nations. And so our 4 panelists today will help us shed light on this critical situation and what we can do moving forward. And I'm so honored to welcome our panelists. Carol Colmenero is a member of the Navajo Nation and serves as the Family Advocacy Director within the Salt River Pima Maricopa Indian Community. Sonia Tetnowski is Maka and the Chief Executive Officer of the Indian Healthcare Center of Santa Clara Valley. Robert McGee is from the Porch Band of Creek Indians and serves as the Vice Chairman of the Creek Indian Tribal Council. Jennifer Van Sciver is Citizen Band Potawatomi and our research assistant at the Buder Center. And I want to thank you all for joining us today. And at this time, I'd like each panelist to speak a little bit more about yourself and to tell us about the immediate impact of COVID-19, what that immediate impact looks like on your work or on your community. And I'll invite Sonia to kick us off here.
Thank you so much, Kelly. It's nice to be here. I'm Sonia Tetnowski, the CEO of the Indian Health Center of Santa Clara Valley. As you know, California was the original epicenter until additional testing occurred. And in my facility, we were one of the first ones to start a drive-through testing. And so I just wanted to, Kelly, would you like me to share my slides now or later?
We can wait.
Okay.
Yeah.
The immediate impact to us was the risk associated with our 23,000 patients. Our clinic currently serves about 114 different tribes, as San Jose was one of the relocation cities in California. And so our Urban Indian Health Center serves a variety of tribal members. So with that, thank you so much for allowing me to be here, and I look forward to a wonderful discussion today.
I can go next. Hello, bonjour. I'm Jen, and I'm currently situated on the traditional homelands of the Potawatomi, Miami, Shawnee, and Delaware peoples in what is now known as Indiana. The immediate impact of COVID-19 for me and the Buder Center mostly meant packing up our offices and figuring out how to provide resources and support to our Buder students from afar. As you know, the university closed down on spring break, so our students were trying to navigate their educational responsibilities, their family responsibilities, and then their personal responsibilities with having an apartment in the area with all of their belongings. Each student and their needs were different. We had to navigate curriculum, course changes, along with event changes. Thanks for having me today.
I can go next.
Wonderful.
Good morning. My name is Carol Colmenero. I am a member of the Navajo Nation. I have been serving the Salt River community for the last 10 years. Initially, I started serving the community as a primary behavioral health therapist, substance abuse, as well as working with trauma. Over the course of the last year and a half, I moved into a position as the director of the Family Advocacy Center. It's unique in the sense that there's not a lot of family advocacy centers as well as child advocacy centers within tribal communities. So that kind of sets us apart from other tribal nations, because we have a specific advocacy center that advocates for victims of crime. So victims of crime can range anywhere from children all the way to elders. So we serve, our youngest child that we've served is infancy. So trauma could range from sexual abuse, sexual assault, elder abuse, a variety of different types of trauma. I would say predominantly what we serve is physical and sexual abuse in our center. COVID has had a direct impact in our line of work. We've also had to, we've been working from home since probably March, the third week of March. And as you know, victimization still continues. And what we're seeing right now, there's a direct impact in sexual assault cases. They're starting to increase. With that being said, we have not had a lot of referrals for child abuse. So that to us is a red flag. That usually we get a lot of referrals from the school, but because COVID has shut down our schools, our referral rates have decreased with children. So that's alarming to us. So right now what we're seeing is more of our adult cases come in. I would say in the last few weeks, we've had several sexual assault cases. I want to thank the Booter Center for allowing me to be here today. I apologize I didn't say that at the beginning. I feel honored to be here and speak about the work that we're doing and the direct impact of COVID.
Kelly, I'll go ahead and go. Robert McGee, Vice Chairman of Fort Portsmouth Creek Indians. Just want to say thank you for allowing me the opportunity to talk about the economies and such, but from the introduction purposes, I think that the biggest thing that the impact was having is, how do we move forward in such an immediate crisis and pandemic? I think a lot of tribes across the nation had to make a decision. They had to make decisions that were very quick. They had to make decisions based upon the resources that they had. And I think a lot of that was very conflicting for a lot of tribes. The Portsmouth Creek Indians were the only federally recognized tribe within the state of Alabama, but we were able to make the decision on March 13th. We closed everything. We closed all of our tribal government offices, all of our economic development opportunities, our gaming establishments here in the state. We have 3. We have 1 in Pennsylvania. We have and some worldwide. And so we made that decision then to stop, just to shut down. And then we issued stay-at-home orders. And the other thing that we were allowed to do was go ahead and just maintain payroll, because we did not want any of our people or our employees to become stressed of the fact of, what's coming next, when no one knew what was actually coming next. And I think that's one of the biggest from just any type of impact that it's had on any nation is, how long is this going to last? What does it mean for, tribal governments? What does it mean for our existence? And especially when it comes to the historical context that I think other people will talk about, is that, this is why it's such a unique time. But I think that, we have now been able to start opening up and it's been, my job is, as head of also governmental affairs and public relations, is just trying our best to constantly educate legislators on the impact that this is having. And so with that, I think it's one of those things I look forward to just engaging with everybody here and learning more. Thank you.
Thank you so much, everyone. And so I'll just start right into a first question I have for everyone. How have historical and structural racism created systemic trauma and barriers to health, to housing, access to food, economic opportunity, just to name a few? And I'll open this up to each of you to comment on that. And specifically, how has this impacted the threat of COVID-19 in your community or in Indian country in general?
Is it best for you? Do you want us just to randomly talk or call? Or?
Robbie, why don't you start us off?
As you can tell, I don't like the silence. No, it's just, I actually, coming from the economy's perspective, and one of the things I was touching on earlier, I think that, there's a lot of misnomers out there when it comes to Indian communities and tribal governments and how our funding, and a lot of that is based upon just historical, regulatory, legislative oversight and such, and and how we have access to the funds that we need to take care of our tribal governments. And I think that is all stemmed from how has the federal government dealt with tribes in the past. And as I think as we were pointing out and talking about in the introductions, is so many things have changed over the since March, that it would take sometimes years to have effective change. And then some of these decisions are now being made overnight that tribal governments have been trying their best to get done for centuries. And that's coming, in regards to access to funding, access to healthcare and such. I think that one of the things that we've realized though during this time is that there's a lot of challenges that still exist. Of course, when it comes to, and I'll just speak from a broader perspective. I think you have some other professionals here that can, drill down into each of these, but from, just the access to healthcare, the access to testing, the access to even antibiotics and stuff. I think that, us not having that, having that opportunity, that, and many of us being in isolation, and not only because of isolation, because we're choosing to from a quarantine perspective, but just from the tribal governments and the nations and the members and citizens that exist throughout the U.S. that are so rural. We have not had that problem here within. We are rural, but not compared to a lot of other individuals and tribal governments that are out there. And I think that we've always had the problem with access to healthcare. But now this access is something that is really needed. And I think that I have to say, though, I think that there's a lot of people out there that are doing their best to provide that access and to provide those funding opportunities. It's just having the best way of I think it comes down to just allowing tribes the opportunity to know what those needs are, and any type of funding opportunities that come down, let them address those needs. But I think that with other organizations out there, with healthcare organizations, I'm the vice chairman for United South and Eastern Tribes. We have an epidemiology center that's been right there helping all of our nations that they can reach out to and to learn about the disease and such. But I think that, from the immediate, and I think a lot of it's just, historically, how has the federal government dealt with tribes? And we all know that, but I think a lot of things now, it's, we've had some dangerous issues occurring, and it's taken notice. And so I think that it's become one of those of many discussions that we know that help is needed and immediate access is needed.
Thank you, Robbie, for bringing up some of the challenges that we've been facing. As many on this panel have probably heard these statistics already, but others that are viewing may not have. Nationally, an individual person gets $11,172 for healthcare each year. Incarcerated members of our society receive $8,602 per year for healthcare. Our tribal governments and IHS services receive $4,078 per year to serve their members. And urbans receive less than $600. So that impact has really highlighted the deficit that this requirement of providing quality healthcare to our members is in the forefront at this point. I will say we have had more legislation and more support during COVID, but this has been a long-standing systemic challenge that we've all faced. And I think that Robbie highlighted that already because of the fact that COVID really just shined a light on the challenges we face, not just with the responsibility for healthcare, but with all disparities: education, housing, behavioral health support. Tribes have treaties with the federal government to provide the support. And the reality of healthcare travels wherever they go. So it's not just for tribal governments. The responsibility is for the Indian person. The person who is a tribal member is allowed to get healthcare. But right now, with less than $600 per person per year, can you imagine what we're trying to do with that to make it a viable healthcare system? Which is really unfortunate, because at the end of the day, our population is increasing. Although statistically we're less than still 2% of the population, we're still growing, we're still expanding. And there's this misconception that because we're economically thriving in some areas of the US, it doesn't mean we've caught up to the rest of society. So we're just barely touching the surface of the impacts of what COVID has done to us. So I appreciate what Carol said from Navajo, because the reality is that they've been hit the worst as far as a particular tribal government with COVID cases. And the fact that it took so long for the federal government to respond and provide those resources was just astounding to me. We weren't prepared, and we needed to have more systems in place to respond. The government has a responsibility to provide us quality health care. And they're working towards it, and people are trying hard right now, but it shouldn't be a crisis issue. So that's why there's this continued longstanding trauma about quality health care and quality support from the government, because it just hasn't been there historically. Thank you.
Thank you, Sonia and Robbie. I'll go next. I could just echo everything you guys said. You said it so well. I think one of the things that I think about a lot during COVID is the historical trauma that we really haven't even addressed. It's longstanding in Indian country. I think in Indian country, and I'll speak generally, I think we know it's there, we know it exists, but the systematic impact that it's having on tribal communities' accessibility to healthcare. I think a lot about the nation that I belong to. If we unpack the policies and all of the policy impacts that have been passed in over 500 years in Indian country, those have had direct correlations to where we are as tribes. Treaties were signed, they're not being abided by. Very basic things that could be fixed if our relationship with the government, if they would, follow through with what they're saying. One of the things I often think about is different tribes are at different levels in their healing with historical trauma, as well as accessibility to care. For an example, we look at rural tribes, Navajo Nation, Hopi. We have 22 federally recognized tribes in Arizona, but not all of those tribes have the accessibility to healthcare, behavioral health, mental health issues. And COVID has just not only shined a light on us, but it gave us a swift kick in the side, because now we're having to function at a different level. We're having to stay in the boundaries of our community. We're having to stay in our home, that our homes might not be healthy for some of the clients that we are treating. So I think about not only do we not have an access to healthcare, but now the victimization has increased for our clients and our community members that we're serving. And it's alarming. It's alarming to me that I will share a story with you when the Navajo Nation when it first kind of got light shed on it about the lack of accessibility to PPE. Myself and a few of my friends sent out a big Facebook thing, and we rented a vehicle and we took out water and things like that. So accessibility to healthcare goes beyond that. It's accessibility to their land. It's accessibility to water. It's accessibility to their natural habitat. That has been gone. That's the impact of historical trauma. So now we throw in a new disease, and that just, it just adds to it. It adds to the impact that it has in tribal communities. I think our communities, I will say that ours are so resilient. Our communities have been pulling together, helping each other out, helping different nations that have been traumatically impacted by this to pull us out. And I think the response to COVID really is based on the accessibility that that tribe has. So if the tribe has the resources and the manpower to mandate certain things, to be able to pay their employees, to send their people home and you know, do a food program, that's not consistent across tribal nations. And because of that, we're seeing high levels in especially really rural traditional communities, like the Navajo Nation, as well as Hopi, those communities, and White Mountain Apaches getting hit really hard. I have somebody who lost 7 of his relatives from COVID, 7. So it's bringing out all of the stuff that has been historically impacted, the lack of our traditional land, our traditional resources to food and water. Those things, we've been set in foreign areas in tribal communities, and we don't have access to those things. So it's bringing a new disease. We're seeing what it does.
Thank you.
Thank you, Carol. I was asked to provide a little bit more information from the slides that I have available. So I want to start those up. One of the things that we have 4 major areas that most tribal facilities, including the urban Indian organizations, provide, which is primary care, traditional healing and medicine, behavioral health services, and social and community health programs. Right now, in New Mexico, AIANs represent roughly 10% of the population, yet account for 55% of all COVID cases. In May, you just shared, Navajo Nation surpassed the New York City for the highest number of COVID cases. And as of June, the Oyet Health Center in South Dakota has conducted 348 COVID tests with 72 confirmed positive cases. In Wyoming, as of June 7th, AIAN accounted for nearly 34% of all COVID cases statewide, despite representing only 2.9% of the state population. Similarly, Montana, where AIAN constitutes 6.6% of the state population, over 12% of the confirmed COVID cases are coming from AIAN community members. This is just a short graph that shows the the COVID cases per tribe. The White Mountain Apache tribe has the highest rate, and Colorado River Indian Reservation has the lowest at this point. But because of what you shared earlier, the fact that we've had limited to no access to testing kits and personal protective equipment, or PPE, it's made it very, very difficult for tribes and tribal governments to respond adequately. Many tribes, like Robbie said earlier, have shut down completely to ensure the safety of their members, and have closed their reservation boundaries to ensure that safety continues. This is just a quick slide of the statistics I shared earlier about what tribal communities are having to work with when it comes to responding to this health crisis with limited resources. Again, things have been brought to the forefront, but it only highlights the number of gaps we have in our healthcare system. And sorry, trying to get out of the share screen. It's not working. To get out of this pandemic and this situation, we really have to be able to have adequate equipment and support to do that. Thank you.
Yeah, I mean, my colleagues expressed so many, highlights within Indian country. Social determinants of health are all of these things. They're the conditions to the places where people live, learn, work, and play, and how these spaces affect a wide range of health risk and outcomes as they've shared. I want to share, for example, this past weekend, I made some homemade bleach cleaner using the CDC recommended mixture from their website. And then cleaned all of my kitchen and other surfaces. And then I went downstairs to do my laundry and help my partner navigate how to do telehealth doctor appointment for the allergies that he's kind of experiencing in this new place. The reality is that I've been able to stay relatively isolated, but our communities in these rural spaces just have not been able to. There are areas without running water, which affects simple tasks like washing your hands and washing your clothes. Our communities also have inequitable access to broadband internet services, which allows for communities to look up recipes for homemade cleaning products, advice about how to stay healthy in COVID-19 times, and notification of resources in the area, such as farmers market, resource drop-off, grocery store restock, and then access to these telehealth and mental health services. These divides are getting bigger and they're growing with our times. So like while broadband internet is now the new thing that is now the digital divide in Indian country, there's just inadequate data within our communities. And so the latest data was from 2013 to 2017 that show only 67% of Native Americans have high-speed internet subscriptions compared to 82%. And this was years ago, and it's underreported, which is why filling out your census is so important, because it comes from the American Community Survey. In addition, in 2019, there was a report by the Close the Water Gap that found that 58 out of 1,000 Native American households lack plumbing, compared to only 3 out of 1,000 white households, which is such a stark divide. So there's these, digital divides, and there's these water divides in American Indians, and they show that Indian communities are the least connected and are the least resources. When you have access to your classrooms and you have access to your workspaces and life-saving critical information regarding this new virus, frankly, the connection to other humans in a pandemic also comes from the internet. And we're just getting further and further left behind.
I just wanted to add one more thing to what you said. Although it does impact a lot of our rural communities because access has not made it to many reservations, it's true for urban communities as well. I have so many of my clients and patients who don't have smartphones. They don't and can't afford to buy internet. And that has also created that anxiety around the fear of the unknown because they're not able to access that information that you were talking about, Jennifer, which is really increased their frustration of having to stay home, right? One of the things that occurred in the population that I serve was the increased number of domestic violence cases because everybody is now confined, and many people here in California have multi-generational homes. So there's more than one subset of their family living in the same home because the cost of housing is so high. Yeah, it just, it is compounding. Each of these issues are putting more and more stress on our people each and every day, that we're not able to have a vaccine and a quality response to it. So thank you.
Yes, thank you.
Sonia, you made me think of something too, as with the domestic violence cases. I think about a lot of our clients that we serve. We've been promoting Zoom and Skyping for sessions for mental health. And if our clients don't have access to the internet or even a smartphone, how are they going to get sessions? So I think it's also about approach, that how we're delivering services to the communities, and we're unable to go to like the traditional go from home to home. How are they getting access?
So true. We actually ended up reaching out to some of the Silicon Valley tech companies and asked them to donate phones for us to share with some of our most vulnerable and our homebound patients, so that they would have access. And then we received a grant to pay for their access because they didn't have access before now. So that's an excellent point. Thank you for sharing that, Carol.
And a lot of that comes from teaching our elders and our community members how to use the internet. And it's an incredible opportunity, but all of that probably requires face-to-face interaction, interaction when you're not supposed to be interacting face-to-face, and that's what's needed.
Can you hear me? I'm having sound issues, but I can hear you all. And I wanted to ask, I read somewhere where someone said they literally categorized the conditions that you all just described. The word they used was unfortunate. And it angered me because I thought there's nothing unfortunate about it. It was deliberate, right? So once nations that had immense resources and were good stewards of those resources, years later, due to systemic policies and practices sanctioned and created by this government, you are now I want to say we're now in these situations where we are choked off from these resources. And for someone to categorize it as unfortunate was just, well, that's an unfortunate person, I think, to say that. So I want to ask you about policy change. I would like to ask you what policies or policy reforms need to happen to strengthen Native communities, especially as we head on the road to recovery and prepare for future crisis.
I'll take a stab at the beginning of that, just regarding from an economic perspective. I think that, one of the biggest problems that we have in Indian country is the fact that just not having control of our own destiny when it comes to our economies. Historically, we know that tribes many times are not allowed to tax. They don't have the appropriate land base. They don't have a lot of the land base of that land held in trust. So they do have the opportunity to expand and such. I think that what's happening in Indian country, and especially right now, is that we always have to remember in any type of policy development or anything like that, the fact that we should not be treated differently than any other government. And as long as we can start any discussion with any type of policy, legislative framework or anything, the fact that tribes are governments, and they should have the opportunity and the ability to handle their affairs just like the other state, county, local governments. And the interesting thing about that is it's because we know what's best when it comes to what our membership or our people need and our communities need. And the fact, when you start putting all these different variables or requirements on access to care or access to funding that, in this case, a lot of it is to care, then you're automatically, restraining tribal governments to do what they need to do. And so even just what we've been, advocating for and such is that when they were doing the CARES Act funding and the HERO funding and such, that automatically we need to first have an understanding of what the definition of tribal governments is, and and who has the access to those dollars. Second, we cannot put restraints on, maybe it's only first line responders, or maybe it's only, this money can only be spent here. When you start putting all the restrictions because they feel that, tribes possibly can't manage their own funds, and historically we have proven that we can, and that we do very well when we have the opportunity to make sure that we control our destiny, that when you start putting these type of restrictions on any type of availability of funding, then you're only limiting tribes to address the immediate needs that they need at that moment. As Shawnee and Carol and Jennifer were talking about, there are things that need to be done right now. And a lot of tribal governments are concerned that if I do this, if I spend this money here, am I gonna, get an audit? Am I going to, it's gonna come back and say that wasn't appropriate use of those funds, and now you have to send back those. So you're putting tribal governments in another risk that they, somebody allocate this money, spend it here, and then it has to then be paid back. Or the other one too is, it's like not knowing where they can spend. And so you've provided tribes an opportunity through this funding that, okay, here's this much, hundreds of $millions, but I'm concerned that tribes are not going to be able to utilize all the money that they've been provided because of the restrictions that were put in place. And so anything going forward, and we've talked about this, any type of, I've advocated for, and many, when you talk about 477 programs and taking the money, putting those funds together to just, address an issue. I think that any type of opportunity for tribal governments, that's the way it always should be. And so if it's regarding, you have so many different, the problem you're running into too with COVID is that you have so many different agencies that have COVID money. However, and a lot of the, sadly, which most of these are grant monies, and everybody is in lockdown. Tribal governments have not come together. Many of them haven't, unless they have a war room set up and things like that. And so they don't even have the resources to provide for a lot of these grant applications. They're just not available. That's a huge problem. And the other one is, is the fact that I've had witnessed that checks or monies has been sent down, but mailrooms aren't open, or, they're not having, they're just having the problem of having just access to some of this funding. But I would have to say the biggest change that needs to take place now is making sure that any type of funding comes through is always recognized that these are governments. They should be able to spend those, take those funds and spend them where they're needed. And if it's in, if it's Carol's case and within, the population she's working there, if that's where these funds need to go, then she should have the ability to take some of that and use it there. The same with Sonia in healthcare. The same with us. I mean, there's a lot of tribes that experience a loss of revenue, and not many people are, because of the fact we don't have the opportunity, we don't have the availability to tax. And so when you're paying for all your employees to stay home, because that's what the administration has said, your state governments have said, your local officials have said, and if you're paying those individuals to stay home and without any type of revenue coming in, then you should be able to take any type of funding that comes to apply back to that loss of revenue, because you're making the decision to protect your people, to protect your employees, and you are mandating them to stay home in a safe environment. And, and that, so any type of funding that comes through, that we should have the opportunity to make sure that we can recoup those type of losses. I think someone brought up housing. That's a whole other issue that, many people, it's like when you have to quarantine, well, now people don't even have the availability to quarantine if they're living in crowded housing, conditions. And that's being experienced in a lot of places. And so if they feel the need that, okay, we need to take this money to put it here, if it's either from a rental program or for seizing, I know some people have turned hotels into quarantine places. Unfortunately, that is the times that we live in. If that's something that tribes need to do, they should have the resources to do that. I can go on and on about the resources and what policy changes, but I think when it comes to this COVID related that we're dealing with is the fact that just, having the access to the dollars and having the opportunity, to tribal governments to determine where it's the best needs for those funds.
I'll go next. This is Carol. Policy is, I love talking about policy. I think like Robbie, I can talk on and on and on and about it. I am a big believer in systematic change from the beginning. We have been functioning for the last 100 years as a Band-Aid approach. Rip the Band-Aid off. That's kind of my whole philosophy. Let's get down to the nitty-gritty and deal with it. And the bottom line is healthcare inequality. Bottom line. And I'm sorry, her name, Sonia. Gave us a wonderful, sorry, Sonia, gave us a wonderful slide on that about healthcare inequality, about dollar signs. Per capita, it's super clear that American Indians and Alaska Natives are getting over, what is it, 50% less than the average inmate in the United States. So if we want to talk about policy change, we got to talk about at the beginning of time when we talk about healthcare inequality in Indian country, it's black and white. It's right there. We do not have the same amount of dollar signs that somebody who in the United States, an inmate has. That's a problem. When we know that we are leading in type 2 diabetes, we're leading in cardiovascular disease, we're leading in alcoholism and unintentional injuries, but yet we only have less than 50% of the access than somebody that's incarcerated does. That's a major problem. So talk about policy change. We need the advocacy and the policy has to begin at the top with healthcare inequality. That's where it exists. We have there's federal treaties that were signed that says one of the biggest one is that the United States will assist and be responsible for the healthcare services and resources to American Indians and Alaska Natives in the United States. And the answer is clear, that is not happening because of funding. It doesn't exist. So I think if we look at COVID and the impact of that COVID has had in tribal communities, it has to start at the beginning with the accessibility. When we talk about accessibility, you walk into any IHS facility, it's clear as day. I remember growing up in Tucson, my own personal story about walking into the IHS facility down there, and they still had U.S. Army equipment. U.S. Army, and I'm only 39 years old, so that U.S. they would line us up to access the healthcare center. That still happens. So if I now have health insurance, I could pick up that phone and call my physician right now and say, I'm experiencing COVID symptoms, and I will probably be seen today. If somebody that is in a rural community picks up that phone and has those symptoms, they will probably 100% not have the access and get an appointment today. So that's the kind of disparities that is existing. So with policy, we got to start at the beginning. You have a federal obligation to Indian country, and that's not being met. We got to start there.
Also, policy is predicated on a Western lens. And so whenever we like look at policy and we talk about individual and immediate family units, when Indigenous peoples, there's strength, there's inherent strength in multi-generational housing, and there's strength in being able to come together as a community. And I would love to see policy kind of shift the focus around this immediate family and more around a community, and how do we make a whole community healthy, not just 4 or 5 houses on one block. It's got to be the entire community, and it has to be up to the governments themselves. It can't be a one-size-fits-all approach. It's completely tribe to tribe specific. That's sovereignty.
Thank you. Sonia, would you like to add anything?
Sure. I agree with everything everyone has said, and it's time that the government prioritize us. I just want to say that out loud. At the end of the day, they have an obligation to us as a people. And until that happens, we won't get that health equality. We won't get any equality. The reality is that this, again, just shined that bright light on the fact that there are so many deficits that we're working from as a people. So that strength that we have, we've done that on our own. That resiliency that we have in our communities is because of us and who we are as a people, not because of any other support that we've received, but we have they have an obligation to provide that to us under our treaties. And it goes with us where we are, not just within the boundaries of our reservations. It's us as a people. They have an obligation to us individuals. They should also be supporting every tribal government. The governments are completely underfunded. The gap is so high that you can't even imagine how deep of a hole our tribal governments are working out of, but they're doing it successfully, and they've done it on their own. And they don't need somebody telling them how to spend their money. They don't need somebody dictating to them, you're only eligible for this, you're not eligible for that. But every city is eligible, every state is eligible, every county is eligible, but tribal governments aren't. And just to reiterate what everyone else has said, with their sovereignty, they should not be obligated to do it all the same. These funding sources are designed to fit into a really tiny bucket. You have to meet these parameters or you get nothing. And that has made it impossible for many people to be able to respond adequately to this pandemic. We have to be a priority. That's how policy can change. You have an obligation to us, you need to prioritize us now. The days of us being forced to the bottom and having to fight over a small piece of the pie is unacceptable to us now. They need to provide us adequate support so we can serve our people the way that they deserve to be served. We gave up a lot to get these benefits, and now we're not getting that result from it. Thank you.
Thank you all so much. I think you've highlighted some really critical aspects of this conversation, especially when we think about healthcare policy, healthcare change, and our sovereignty, and the unique and different ways and needs of our communities. And so I'd like to pose a question from the chat. Thinking about the different solutions and support that you've seen or that you've been a part of, that you've led, can you comment on some of the innovative services or adaptation that you or your tribal community have used to support your tribal members?
Can you repeat that?
Yes, certainly. Comment on or share one or two innovative services or adaptations to services that you've made because of COVID-19 that you've used to support your tribe or tribal members.
You know, I know one of the things that our leadership has done, and I have to give them that a lot of respect for, was taking immediate action. And when I say that, meaning they created a war room, it's like they're coming to work and to be able to come together and say, what do the tribal members need? What do we need to do? And one of the things that we did immediately was shut down our assisted living facility. When I say that, meaning we quarantined all of our elders that were living there, meaning no one goes in, no one goes out, until we can, because we knew you had already were hearing about at this moment that this is the most, the critical population and such. And so, we took immediate action to protect them. I think the other one was in having the availability of PPE. And so we started, we have a metal manufacturing company also. And so we started making a lot of gowns and things like that for area hospitals, tribal communities, and providing those to the United South and Eastern tribes to have access to those type of things. And I think one of the ones that we just finished was creating an economic, it's almost like a recovery disaster fund, because like I said, even though we were allowed to pay our employees to stay home, many of our members, they don't live here, they have other places, and a lot of them have experienced economic hardships. If they live in California or Arizona, and they may have been furloughed, or they may have lost their jobs. And so we did create a fund through our Family Services Department that they can have access to disaster relief that way. Because unfortunately, you're not going to know about all of your people and what they're going through. And so I think that the other thing too that I encourage a lot of tribal governments is just having continuous transparency and open communication and dialogue. And so we have been sending out, we're a little bit technologically savvy, I guess you could say, and we do have the resources, meaning we have Wi-Fi and things like that, which like I know many tribes don't, but we send out rapid texts, we send out rapid emails, we send out rapid automated voice calls to letting them know everything that's going on and what they have access to, what's open, what's not, stay home, do this.
And this is Carol. Similar, we have, at Salt River, it's similar. It's we have the access to internet and social media we have it. So with that, we've been utilizing that as a platform, especially for folks for victimization. So for domestic violence, mental health, healthcare. Our healthcare center has been really instrumental, our Health and Human Services Department, on working on really prevention, really educating about COVID and being indoors and how to protect yourself, but also from a victim's perspective. If you're experiencing domestic violence, here's some numbers you could outreach. So the outreach and the prevention is still happening, and our platform we're utilizing is Facebook and social media. It's more not in person, but over, telehealth, things like that, because this community, or the community I serve, has that access. And I think it really speaks to accessibility. If some tribes have it, then they're able to utilize that as a platform. I think it's tribes that don't have that access. What are they using to get the word and to work with the clients in the community?
For us, I shared a little bit about the ability to have access to telehealth. Telehealth was one area where we were able to launch quickly, but we had to do a lot of training. We had talked about that a little earlier in the conversation around the fact that I have some folks, again, just like every other person, some people who are technically inclined and others who have a much more challenging learning curve when it comes to utilizing technology in a way that can optimize the experience for healthcare right now under telehealth conditions. And so what we've been doing, like I said, was reaching out to other organizations to get additional support for electronics to be able to share with those that need it most. The other thing I wanted to share was we've been looking at ways to help offset costs or transportation so people can get tested. So the more people that get tested, the quicker we will be able to stop the spread. So for us, our goal continues to be testing. How do we get more people tested? How do we address and support those that may test positive? And how do we provide housing for them so that they either can social distance in their house or they can be quarantined at another location so that they can get the support that they need. So those are a few of the innovative ways we've been trying to address this quickly.
So we're getting close to the end, and there's more questions in the chat, and I just want to acknowledge that Logan asked about, were the narrow requirements for funding a result of racist design or ignorant governance? And you might want to, if our panelists want to answer that, they can answer it in the chat. Logan did, thank you, Logan, for the question. It did make me realize that as I heard Robbie and Sonia and Carol and Jen, as I heard you all mention, Jennifer, sort of not just the policy change, but the ways you had to innovate and the conditions under which Native people are experiencing life in general and life under COVID-19. I heard some things in terms of culture, American culture being white supremacist and dominated. I heard how we are all hurt by the paternalistic, by the power hoarding, by the scarcity mindset that has permeated American culture. And so what I want to ask as my final question, because Black and brown people are in a moment of civil rights. We're seeing one of the largest civil rights movement right now. And I don't think it was just spurred by the murder of George Floyd. I think all of the conditions that non-white people in the United States were experiencing because of the pandemic, on top of police brutality, on top of the hordes and hordes of injustices over many years have put us in a critical civil rights moment. So I want to ask you, how do I show up in solidarity for Native and Indigenous peoples? What can I do? What should I be doing to express solidarity?
I think that, maybe these type of, I think there's so many different avenues or ways to go about doing something like that. And even hosting forums like this, I think that is a great opportunity to getting the message out and such. I do agree with you that, we are, at this moment in time, I think that there's a lot of effective change going on. Now, did it happen, because of what you stated? I think no. I think it's been one of those things just historically, it's been building up and such. Even from, Native Americans and such, we've been fighting a lot of these issues ourselves when it comes to mascots, when it comes to missing Indigenous women, that, it's a lot of people, we weren't able to get a lot of that out to a larger spectrum of people. And I think that's what's happening now is it's not just about this. It is also about, what tribal people I think have been experiencing too. But I think that, it's in a world of the technology that we have now. I think that it's just, doing your part to, get involved, express your beliefs in a safe environment. I think anybody can do that, appropriately. There's no reason to, from a combative perspective, I think it's just being, being able to share and such.
I tend to agree. I think having the willingness to show up and say that that's enough. Indian people are here to stay. We're not going anywhere. We're only growing, getting more educated, and expanding our both economic and our human resource capacity. And we really need the opportunity to get that voice out there. And so I think the more that you can do to share your opinions and share your support would really help to ensure that our messages aren't lost in the injustices of the world right now. There's so many. We're not the only ones. I understand that and I recognize that. And I appreciate Robbie bringing up the missing and murdered Indigenous women, because I actually made that note prior to your talking about ensuring that we talk about that, because actually this quarantine has only expanded those losses because nobody is paying attention, right? When you're in quarantine, people aren't paying attention when somebody's missing because you just assume that they're in quarantine at home. You're not realizing that they're actually not there anymore. So the numbers of missing and murdered Indigenous women is increasing during this process. So that is also a very scary statistic right now. So the more you can pay attention to that and pay attention to our issues around that, that would be much appreciated. Thank you.
I think whenever I've heard from people, I often hear that's sad. And I really want people to stop thinking the history and the story is sad. I want people to start lifting up the resilience. And the fact that we're still here. And if you don't see us at the seat at the table, bring us in.
Excellent point.
Mm-hmm. Yeah, thank you all so much. And I think we're just about at time here. And I know some of our panelists have other meetings and things they need to attend. And I'd like to thank all the panelists for taking the time to come and join us today and sharing your knowledge and participating in this way. We all so much appreciate that. And I also want to recognize and thank you for the hard work that you're doing within our communities. So thank you all so much.
Thank you for inviting me.
Thank you.
Thank you.